It's really a pleasure to be here talking to so many people who know so much about transportation. I'm not a transportation person, I'm a health person, but I'm a health person who's been interested in transportation for a long time. I think probably everyone knows that the recent report by DOT said that most of the fatalities occurring are on arterial streets. They're mainly occurring at intersections. They're mainly occurring when cars are turning and hitting pedestrians. But then speed here is a major contributing factor. And I wanted to raise that because obviously the speed is the subject of this conference. The number one contributing factor was speed. And then after that you have driver inattention, failure to yield right away. So you can sort of get a picture of what's happening here. You just can't emphasize this enough, that after quitting smoking, there's probably no behavior that promotes health more than regular physical activity. Okay, that's great, but then what are we going to do about that? Well, to me, the answer to that is thoughtful urban design and transportation infrastructure. That's can simultaneously promote physical activity and reduce injuries. Often when I talk about this, people present these as being some kind of trade-off. That, gosh, if you make it easier for people to not be in cars, you're going to increase injuries. And to me, it's just the opposite. I think a thoughtful design can do both at the same time. And so we can be attacking two of our major causes of death through one act. So that's as much expertise as I have on transportation. But that's how I get to it. And that's why I think what you in this room are doing is so important. And why I'm excited about the idea of people who really spend a lot of time thinking about transportation are thinking about how to reduce speeds and reduce injuries. It's not only going to prevent injuries, it's going to increase physical activity with all sorts of enormous health benefits.